Hello everyone, let me introduce myself first. I'm Lizette Liquez from Entry B, proctored by Ma'am Chet Durante. So what I'm going to discuss today is about Legionnaires Disease. What is Legionnaires Disease? Legionnaires Disease is a typical pneumonia and caused by negative bacillus bacteria of the genus Legionella. It is also facultative intracellular pathogen, which means that the disease lives in the cell, or it can goes into the cell. Legionellosis is a potential fatal infection disease caused by gram-negative aerobic bacteria belonging to the genus Legionella. Over 90% of Legionellosis cases are caused by Legionella pneumophila, a ubiquitous aquatic organism that thrives in temperature between 25 to 45 Celsius or 77 and 113 Fahrenheit with an optimum temperature of 35. What is the scientific beginning of Legionnaires' disease? Legionnaires' disease acquired its name in July 1979 when an outbreak of pneumonia occurred among people attending a convention of the American Legion at the Bellevue Stratford Hotel in Philadelphia. On January 18, 1977, the causative agent was identified as a previously unknown strain of bacteria, subsequently named Legionella. Epidemiology of Legionellosis. Legionella are ubiquitous worldwide. Most cases of Legionnaires' disease are caused by Legionella pneumophila. Disease occurs after exposure to aquatic settings that promote bacterial growth. The aquatic environment is somewhat stagnant. The water is warm, which is 77 Fahrenheit to 108 Fahrenheit, and the water must be aerosolized so that the bacteria can be inhaled into the lungs. These three conditions are met almost exclusively in developed with natural settings such as waterfalls, lakes, or streams. Who are at risk of this disease? Opportunistic disease underlying illness or who has weak immune system. Nosocomial infections are major concerns. It is defined as infection which are acquired after 48 hours of admission, such as patient with ventilator associated with pneumonia. It is middle-aged, elderly, COPD, smokers, and other genetic susceptible patients are primary targets. Transmission of Legionnaires' disease. Legionella pneumophila is not spread by human-to-human interactions. It's transmitted by mist or vapor contaminated with bacteria. Also, they live in warm stagnant water, which 90 Fahrenheit to 122 Fahrenheit in complex systems in ideal. The clinical presentations for Legionnaires' disease, the early symptoms are malaise, which the person is discomfort, muscle aches, lethargy, the person lacks of energy, and slight headaches. High fever, non-productive cough, abdominal pain, and diarrhea. For the late symptoms, extreme lethargy, comatose state, impaired kidney and liver functioning. Also, nervous system disorders. For clinical presentation of Legionnaires' disease, Legionnaires disease typically present with pneumonia, which usually requires hospitalization and can be fatal in 10 to 15% of cases. Symptoms onset occurs 2 to 14 days after exposure. In outbreak settings, less 5% of people exposed to the source of the outbreak develop Legionnaires disease. How Legionnaires disease diagnosed? First, they use urinary antigen test. This test detects a molecule of Legionella bacterium in the urine. Also, culture. Culturing specimen can detect Legionella species and serogroups that the urinary antigen test does not. Detects all species and serogroups clinically, and environmental isolates can be compared. Also, they use serology. This test is an antibody test, looks for the presence of antibodies, which are specific proteins made in response to infection. Treatment of Legionnaires disease. Sadly to say, there are no vaccines that can prevent Legionnaires disease. However, Legionnaires disease is always treated with antibiotics. Treatment is usually started as soon as the disease is suspected without waiting for confirmations. Instead, the key to preventing Legionnaires disease is to reduce the risk of Legionella growth and spread. Building owners and managers can do this by maintaining building water system and implementing controls for Legionella. Treatment of Legionnaires disease. Sadly to say, there are no vaccines that can prevent Legionnaires disease. However, Legionnaires disease is always treated with antibiotics. Treatment is usually started as soon as the disease is suspected without waiting for confirmations. Instead, the key to preventing Legionnaires disease is to reduce the risk of Legionella growth and spread. Building owners and managers can do this by maintaining building water system and implementing controls for Legionella. So that's all for my presentation, and thank you for listening, and I hope you understand this Legionnaires disease.